Good morning, and thank you for joining us for the May 26th COVID-19 virtual news conference. My name is Mariah Miracle, and I'm a Public Information Officer working in the Joint Information Center. Let's start by introducing this week's panelists. EOC Operations Chief Sofia Pereira, Humboldt County 3rd District Supervisor Mike Wilson, County Health Officer Dr. Ian Hoffman. I'll start with a brief overview from the Joint Information Center. As of yesterday's most recent update, a total of 4,253 residents of our community have tested positive for COVID-19. That's an increase of 101 cases over the last week. 183 people have been hospitalized, 6 of those since last week. And the county has lost another member of our community to COVID-19 in that time, and a total of 43 county residents have died with COVID. Yesterday, CDPH updated countywide metrics, and of California's 58 counties, Humboldt had the highest positivity rate at 7%, and the highest case rate at 12.2 cases per 100,000 residents. The Joint Information Center continues to answer COVID-related questions from county residents. And if you have questions, or if you'd like to speak with a public health nurse confidentially, give us a call at 707-441-5000. Now we'll hear from our panelists who will give a brief update on what they've been working on in relation to the COVID response. Let's start with Ops Chief Sofia Pereira.
Good morning, everyone. Last week at the Supervisor Clinic for ages 12 and older, we did see a really good showing. So really grateful to see folks coming out to our vaccination clinics that we're hosting. We are hosting another first dose Pfizer clinic tomorrow at CR and next week at CR as well. We do still have appointments available for tomorrow even, so you can go to myturn.ca.gov to get signed up for tomorrow's clinic. And that's for ages 12 and older. And as you know, vaccination efforts are happening throughout the community, throughout the county with various providers and community partners. For example, yesterday, the Northern Humboldt Union High School District partnered with Rite Aid for a clinic at Mckinleyville High. And it's just really great to see the local collaboration and in action. Public health, we've been working with partners, and it's great to see folks connecting with each other as well and taking that initiative to make sure folks in our community are getting vaccinated. So I did want to know, if you can't make it to one of these public clinics, pharmacies may also still have open appointments. So you can go to vaccines.gov for more information, or you can go directly to the pharmacy websites to sign up to see if there's an available appointment near you. And lastly, the North Coast Testing Partnership that the county has with United Indian Health Services is providing multiple sites across the county to get free testing. And UIHS is also vaccinating at these sites. And there is no appointment needed. Walk-ups are welcome. So if you are interested in stopping by one of those sites, they go to Oric, Trinidad, for example, they go out to Wichita, go to northcoasttestingpartnership.org for their schedule, and you can sign up online for an appointment to get tested, or you can walk in. So thanks, everyone.
Thanks, Sophia. Supervisor Wilson.
Well, thank you very much. So I don't have a prepared statement today, other just to be here in support of our staff and the county functions of really promoting vaccinations in our community. We really need to move towards a higher percentage of our population to be vaccinated if we really want to be safe and not have the impacts that we've been seeing. Our numbers are not good, and we're moving into a place where they're going to become even more dangerous for unvaccinated people when the state moves towards opening up. And so I just implore everybody to understand that it's not just for the safety of oneself to become vaccinated, it's for the safety of others. And if you are still choosing to be unvaccinated, please take that into account in how you move through the community. Please mask, please do not engage in or encourage gatherings, at least with the participation of yourselves that are unvaccinated. It is causing real stress in the community with these numbers. It's putting people in the hospital. It's closing businesses. It's impacting our abilities to open up in so many ways, and it's impacting people who can't get vaccinated, children who can't get vaccinated, people who can't get vaccinated for medical reasons. So I implore anyone who is unvaccinated, please take the personal responsibility seriously. Please reach out to, if the issue is a medical one in terms of your information, if you feel like you aren't receiving good or have good medical information, please reach out to your provider, your doctor, the place you would actually go to get medical information. I'm asking folks to please really consider helping us move to the next level. Thanks.
Thank you, Supervisor Wilson. Dr. Hoffman, can you share an update, please?
Thank you, Supervisor Wilson. Thank you, Sophia. Yeah, I wanted to do a little recap of where we are in the pandemic. We started off in March of last year with an unknown virus that we saw sweeping through towns and countries across the world. And we saw devastation in the hospitals. And so we took strong public health measures of locking down society, locking down businesses, closing schools, closing everything really, other than the absolutely essential services to protect the public and protect the individuals, and really with the ultimate goal of protecting our hospital capacity system. We needed to, because we knew this virus passed very quickly among the population without any of those measures. And we saw the effect of that over the past year here in Humboldt County, where we did not see those surges in our hospitals. We never saw the capacity become overwhelmed. And we did that while we were waiting for a vaccine to give to people who then, once vaccinated, we would feel confident that they could return to normal societal functions and not become not have this overwhelming surge of cases flooding the hospitals and overwhelming the capacity. So that's where we're at right now. We feel very confident that we will not see that level of hospital capacity surge. And that's why we are opening up society again. Despite the fact that we don't have vaccination rates that are high enough to protect everyone, we have enough vaccine to offer to those who are willing to accept it. So what does vaccination do for the individual? It protects them against severe disease. It protects them against hospitalization. It protects them against death. And I think that's really important for us to keep in mind, because what we're still seeing right now is in the unvaccinated population, the reason we're having the numbers that we're having is because they're still getting sick and they're still spreading this, and we're still seeing hospitalization. So I don't expect that to change anytime in the coming months, unless we see a dramatic change in our vaccination rate. We have about 60% of our eligible population who've got at least one shot. So that's actually really good. We're in a good spot for for what we're looking at nationwide, what we're looking at with the rest of California. But to feel safe and confident, we still need more. We want to try to continue to protect the way we did for the last year, but not with the same measures. We don't want to continue to lock down all of society, for any longer. We know the importance of getting back to normal. So the only tool we have left is really vaccination. And so I'd like to put out a call to Humboldt County to try to get to 75% vaccination of the eligible population by June 15th. We have 3 more weeks to go, and we have plenty of vaccine in Humboldt County. And really, like Supervisor Wilson, want to urge everyone to reach out, try to overcome those barriers, whatever they be, whether it's transportation barrier, an economic barrier, a knowledge barrier, questions about the vaccine, a medical concern. Reach out to your doctor, reach out to the JIC, look for information, and try to find a vaccine clinic before June 15th, because those protections that have been protecting us, the unvaccinated up until that point, are going to go away for the vast majority of us. So we're shifting from really a public health response of protecting the entire public to a personal responsibility of each individual needing to take on that responsibility and take the responsibility for their own health. So that's what we're looking at for June 15th. We're going to continue to push the vaccine out and try to break down those barriers as best we can in the coming weeks. And, we're going to continue to also mount the investigation response that we've had throughout the entire pandemic, throughout the entire response, and plan to continue that into the summer. And so also another tool that we have left, in trying to slow the spread. And if you do get sick and you had contacts, letting us contact those folks and giving us those contacts so that we can alert them, so that we can slow the spread and slow this thing down. And again, give people more time to get to a vaccine and, hopefully not get ill and get hospitalized and have severe outcomes from COVID-19. So thank you so much, and look forward to the discussion today.
Thank you, Dr. Hoffman, and thanks to all three of our panelists. With that, we'll take questions from reporters. Let's start with Thaddeus Greenson from the North Coast Journal.
Thanks, Mariah. Appreciate it. So I guess I'm curious to start on the vaccine front. Obviously, as you said, Dr. Hoffman and Ms. Pereira, we're at a place where we're now entered an era of vaccine abundance, and our rates have still kind of declined as far as the number of people getting vaccinated every week. And so I'm curious to hear from you guys what you feel like those of us who have been vaccinated can do to kind of further this effort, both as individuals and then also as businesses and the network of nonprofits that we have in Humboldt County. Is there a role for each of those entities to kind of move the needle here?
Sophia, can you start? Great, thank you.
Absolutely. So I'll speak at an organizational level. If there are employers, so businesses, community-based organizations, nonprofits that have identified that they still have staff that need to get vaccinated, there is a state resource. There is an employee vaccination toolkit that the state has offered. And I believe the Joint Information Center has released that resource to the public. But that is a great place for an employer to start, or a community-based organization to start if they have staff that they would like to get vaccinated. I know we've gotten contacted by some employers going, how can we best support our employees in communicating the need for vaccination? And so that's a really great toolkit that has great messaging, information to provide to your employees. And then also, if you are interested in getting vaccinations provided to your staff, you can reach out to that resource and they'll try and connect you. But we do have so many options in this community. You can go to myturn.ca.gov for the clinics that are on there. We have pharmacies in this community that are offering clinics. And so there's really so many different options. So if there's employers and community-based organizations that want to get folks vaccinated, there's a lot of ways to get them connected. And Dr. Hoffman, I don't know if you have anything to add.
Yeah, thanks, Sophia. I do think that's a great resource. It just came out. The JIC put out media release on that. I think it was yesterday. So definitely want to promote that resource for any business, nonprofit, even schools could use that to try to ask for information about how they can hold a clinic. It's to help link people to community partners who are doing vaccination right now, if there's capacity, or help us figure out a way to create that capacity if we don't have it. So we're looking forward to hearing what the needs are from those businesses that haven't reached out to us yet, those nonprofits, those schools who want to have clinics for their employees or the people who they serve. On an individual level, I think it's a great question, Thad, and we each individually can move the needle on this. I think, when we talk to our family and friends, it can have an impact. We tell them why we were vaccinated. We listen with an open mind, and we try to be non-judgmental. We know there are a lot of different reasons why people aren't getting vaccinated. Again, some of them are barriers, some of them are knowledge and concern, but I think starting from a place of empathy and understanding of anyone who doesn't want to get vaccinated at this point, just listen to them, listen to what they have to say, and try not to judge them. And then offer your support and offer your recommendation for vaccination because you want to protect them, because you love them, because you want to protect their family and their community. And so I think those are the things that all of us can do as individuals. And then going back to businesses, we've encouraged businesses to offer paid leave to go to a vaccine clinic, paid leave if they have side effects from a vaccine. I think, those are the kinds of things that businesses can do. And again, just taking that personal approach of asking your employees, well, why is it that you're not getting vaccinated? And listening and being empathetic, and then encouraging them to get vaccinated in a open-minded, empathetic way. So those are the recommendations that I would give for folks trying to continue to move the needle. And I think we can do it. I think we're still in a stage where there's a lot of people out there who have barriers who we're trying to overcome, and a lot of people out there who are still just have questions. They're not necessarily absolutely against being vaccinated, but they have some questions, or they want to hear more from people who did get the vaccine.
Excellent. Thank you, guys. And just a quick follow-up to that. You mentioned barriers, and I mean, obviously some of those are knowledge-based or philosophical, but some of them are more physical as far as transportation or access. Following up on the first question, is there a role for local nonprofits to potentially mobilize and create a ride-sharing program or anything like that you can see being helpful in this effort as it moves forward?
Yeah, I think anyone who's willing to help, now is the time. Put the resources together. An example is Rio Del. We had a clinic there a few weeks ago, and the community really came together. They put together rides to the clinic. They put together support. They got the word out through their networks in the community. So those are the kinds of things that can definitely be impactful at this point. There is also on my turn the ability to get help from the state to try to find what sort of resources might be available if transportation is an issue. That is when you're registering for my turn, you can identify as having either transportation issues or being homebound. You'll be contacted by the state to get some questions and see what sort of services might be able to help you get to a clinic, or even just letting you know, maybe there's clinics closer than you realize through other sources, through the pharmacies, and through clinics that are in your area that you were not aware of. So I think that's what we're all working towards right now, is to break down those barriers. So any help we can get from anyone at this point, for sure, we'd appreciate that. And now's the time.
Can I jump in here just for a second? I just want to emphasize too, like, we put out all this information, go to my turn, go to this, go to that. And it can seem a little bit confusing to somebody, but I have to say, if you feel like you're kind of overwhelmed with all that information, calling 441-5000, the folks there have been so helpful. I've referred several people to this number, and they have come back and said they've really gotten great information. They've gotten and direction on how and where they can get the resources to have access. And I know I myself and other supervisors have offered, and anyone in the community that is really working hard to get people vaccinated, contact people if you do have barriers, reach out, whether it's through these official channels, whether it's through your friends and family. Please make an effort to reach out if there are any barriers to helping you get to a vaccination. Thanks.
Excellent. Thank you, guys.
Thank you, Thad. Any other follow-up questions on that topic?
Yeah, I actually have one. Isabella with the Times Standard. So the JIC has talked about improving mobile or starting more mobile clinics to boost vaccination efforts. And I'm curious as to how that effort is going and what areas we are reaching that we haven't reached before. And also, who is public health having the most difficult time reaching? I guess, an age group, a demographic, and what's being done to improve that outreach.
Sure, I can speak to that. So in the EOC, we've been coordinating mobile outreach. And so this right now, since we are in a transition from doing the very large clinics to mobile, so we're currently in that phase where we're still wrapping up second doses. We're still doing first doses at CR in smaller numbers to reach that 12 to 15-year-old population. So we're in this transition of still doing some of those static sites as we move towards mobile. So we've gone to Rio Del, we've gone to Samoa, we've gone to Petrolia, and we plan to go back out to Petrolia. The demand was very high when we went there the first time, so we're going to be going back there in June. And so, we're also looking at, we're looking at also different social service providers and connecting with them and getting their clients vaccinated as well. And I really want to give a lot of credit to our team. They work so incredibly hard. There are so many logistics that go in to coordinating mobile outreach, especially while we're doing static sites that have a lot of logistics as well. So I really want to give a lot of credit to our public health and EOC staff that are working so hard to make sure, and this is a small and mighty team, working so hard to make sure that we're going out to these communities. So more to come, we're in this for the long haul. So we'll be continuing that mobile effort, and we're going to put everything we have into it. But we've seen success in the communities that we've gone to so far, and we're optimistic about what that's going to look like as we go through the summer months.
Yeah, and I thank you, Sofia. That's a great recap. And add to that, these businesses that we're looking at, schools, other, organizations, service organizations, all of these things are, in the planning, in the works. And they're, really, we're doing this, like Sofia said, with a small and mighty team. We are, public health, but we're all public health. So we're also coordinating with a lot of folks around the county. So working with UIHS to get their mobile vaccination units up, working with other partners in Southern Humboldt to see what sort of outreach could be done to their community, linking up folks who we've had conversations with other providers. And another good example of the kind of, just the efforts that are going on is the Mckinleyville High School vaccination clinic Sofia mentioned, partnering with Rite Aid to make that happen. So, people can start to reach out to their other providers in their community, see what's happened. I know folks have reached out to Open Door. So we're at a phase now where really just getting creative and utilizing as many creative opportunities as we can to get the vaccine out there broad and wide. And I'd also say this isn't going to end on June 15th. We're not stopping vaccination. This mobile vaccination effort, working on continuing to break down barriers is going to happen for a long time, because COVID is not going to go away come June 15th. It's here for the long term, and we will very likely be seeing the spread of this disease through our community, well into next year. So vaccination will be the way to, to protect ourselves individually and to protect our family and our friends and our community. So.
Thank you both.
If I could just follow up on the second part of Isabella's question regarding the demographics that you guys feel you're having the hardest time reaching at this point.
Yeah, thanks for bringing us back. That I think that it's the young folks. We look at the numbers. We have incredibly high numbers in our 65 plus population. Well over 70% of those have had at least one shot. that's pretty incredible. And if you dial it up even more, 75 plus, I think, had over 80% fully vaccinated. So you can check those out on our website. We update that weekly on the Humboldt Health Alert dashboard. But yeah, we're about 50% of the younger folks, and really that, it's hard to look at the 12 to 15-year-olds at this point because they just opened up a little over a week ago. But if we look at that 16 plus population, I think you'll see about 50% up to about age 30 with one shot. And, we'd like to, like I said, get that up to 70%. So it's a lot of work to get that. And so we're looking at those kind of barriers. What are the barriers to that group? What is the messaging to that group? Are they concerned that they just don't need the shot because, this doesn't really affect the young? But we know that's not true. We are seeing cases in younger folks, sicker people hospitalized in their, even teens now. The B117 does appear to be more infectious, more contagious, make people sicker, and hit younger folks harder than the previous versions of this. And each version that comes along, we're seeing P1 come in on the heels of B117, and data is looking like that could overtake, potentially overtake B117, or we might get the new variant, the Indian variant, coming in and replacing B117, like what's going on in the UK right now. So I think until people are vaccinated, this virus will continue to circulate among those unvaccinated folks, and the potential for serious illness is still very high, even in the younger age group. So the vaccine has been proven, it's safe, it's effective, it's been studied. It has gone through all the paces that any other medication or vaccine have gone through. And if you have questions, like Supervisor Wilson said, please reach out to the JIC. We have staff who can answer questions. If it's a medical question they can't answer, they can refer it to a public health nurse. If you don't have access through your own physician or you want another opinion. So definitely encourage everyone, especially the young folks who are still questioning or unsure, whatever that barrier is, to get those answered before June 15th.
And if I may, my apologies, if I may, on the subject of variants, is there any plan or potential plans when it comes to rollout of booster shots that may be needed as we see more information coming in about how different vaccines are more or less effective against different variants?
Yeah, currently the data is looking really strong for all the variants. I think time will tell, but I actually am not seeing strong evidence right now that if we are going to look at a booster shot, it could be, year, 2, maybe 3 years out. I mean, we need data to really know when and if that would be necessary. But it's not looking like it's going to be anytime soon. The immune response is strong, and it appears to be potentially much more long-lasting than we originally thought that it was going to be. I think we're going to keep hearing about studies of booster shots because we want to be prepared. We don't want to be caught, unprepared if something changes quickly. But right now, that's what we're looking at, is that the immunity is long-lasting, and potential booster shots might be far down the road if needed.
Thank you.
Thank you. And Carlos Holguin from North Coast News, do you have any additional questions that you'd like to ask at this time?
Yes, just one more question regarding our case rate. So obviously, as all three of you said, and as
I think you were inadvertently muted, Carlos. Can you start your question again?
Oh, my apologies. There we go. So yeah, as all three of you said, and the Humboldt Health Alert said, we are currently seeing an adjusted case rate of about 12.2 per 100,000, which is one of the worst in the state. Previously, despite the fact that our hospital rate was never at a point where it was being overwhelmed, we were adjusting ourselves to different tiers. I was just wondering at this point why we are not adjusting into different tiers despite the fact that our hospital rate is at the same pace where it's not being overwhelmed, but it's still seeing an increased number of cases.
Yeah, it's a great question, Carlos. So when we were in the earlier phases of the pandemic and we had a large portion of the society who had either not been exposed to the vaccine or been unvaccinated, it was very easy for this virus to spread rapidly and overwhelm our hospital system potentially. The reason we didn't see that here is because people, by and large, followed the public health measures. They stayed at home. They didn't gather. The businesses that were open followed public health measures of reduced capacity, masking. So that protected us. And so again, now that we know we have 60% of our population who are eligible with a shot, those people are protected. Partially, the ones who are fully vaccinated are completely protected. So we know that the potential for this to overwhelm the hospital has really gone away. But we didn't know that back then. We weren't sure how this was going to behave. And I think if we look back at things that happened even in counties in the south of our state where hospitals were entirely overwhelmed, they did end up shutting down the entire hospital for only COVID uses, utilizing their ACS, taking care of people in hallways and parking lots and gift shops. I mean, we are lucky we never had to see that here. And I think the reason, to get back to the crux of your question is why are we not going to lock down more again? It's because we are confident that is not the level we will see now that we have this level of vaccination. Doesn't mean we're not going to see more hospitalizations. We will absolutely continue to see hospitalizations, severe illness, and death from this in the coming months and likely well into next year. And as long as there is an unvaccinated population for this virus to infect. And I might add to just, talking about consequences of getting COVID, going back to the young, we are seeing that long COVID syndrome in young folks, affecting them for months, and some of them it's been almost a year now. The folks who were originally infected last year, young folks with severe fatigue, inability to get back to work, and so this is not just another cold virus. This is a very strong virus that can affect any of us in ways that can change our life. So we want to encourage people to get vaccinated and prevent any of those long-term consequences, be it hospitalization, severe disease or death, or long COVID.
Great, thank you.
Any follow-ups on our epidemiology or case rates, anything like that? Supervisor.
Actually, I have a question for Ian, which is reinfection and the potential for reinfection, because I know that is an issue amongst some folks, and so could you speak to that?
Yeah, so we don't have great data on it yet, but we do know, looking at antibody levels of people who had natural infection and natural immunity versus those who have the vaccine, that the vaccine antibody response is about 5 to 10 times higher than those who had natural immunity. When you look at the people who get naturally infected and the potential for those bad consequences, like I mentioned, of hospitalization, severe disease, ICU stays, and then also long COVID or just being ill for, even if you don't get long COVID, I mean, a lot of people, when they get COVID, they're just so sick for 3, 4, 5 weeks. doesn't happen with the vaccine. You know, we don't see any long-term consequences. We don't see the illness like that. And so it's really a preventative measure.
Thank you both. Any other follow-ups on that topic? All right, we'll go back to Thad from the North Coast Journal. Any additional questions?
Yeah, thanks, Maria. I'm curious, it seems like in the, I guess in recent weeks, the county has ramped up calls for folks to cooperate with contact investigations, intoning that that's not happening or is happening at a lesser degree than it was before. So I'm curious to hear from you guys about contact tracing efforts currently, what some of the barriers are, and then also how much more complicated that might be become come June 15th, when I imagine anyway, there's going to be a lot more people intermixing within the community and a lot more contacts for each positive case.
Thanks, Thad. Yeah, it's something that's been there all along. We have definitely struggled at various points in having participation in investigations. But I think now, given the fact that vaccine is widely available and many people who wanted the vaccine have now gotten the vaccine, I think what we're seeing is, again, that these infections are happening in the unvaccinated population. And so, you know, for whatever reason, that's where we're at and what we're coming up against. And so I don't know if I would say it's, you know, any different than it's been all along. I think it's just a shift in where we're at in the pandemic. It's fatigue. I think there's some fear, also ramifications of what happens, you know, if you're positive, potentially, you know, having to notify your contacts or taking time off of work, you know, dealing with childcare issues. So what the benefit of participating in the contact tracing is that, you know, you're really going to protect your loved ones, your family, your friends, your community. You're going to keep the businesses open, because what we see sometimes is that these businesses have to prolong their closures because one person gets sick and they, you know, if they don't isolate for the full period and they come back too soon, they can get other coworkers sick and infected, and then it just cycles through. Or in households where, you know, again, if we can follow those precautions, it won't cycle through and prolong the infection of all the folks, and can just stop that chain of transmission. So, you know, in the future, I think, you know, what we're looking at in terms of where contact tracing and investigations are going to go, you know, come June 15th with reopening. You're absolutely right. It's going to be a different ballgame. We're basically only going to be able to protect the big outbreak situations and focus on high risk settings. And I think that individuals who get infected and smaller businesses are, you know, we're not going to be able to continue to follow up on every single one of those. So it's really going to be focusing on those high risk settings, focusing on schools, the youth who aren't vaccinated, focusing on really large congregate settings where it could move through a lot of people very quickly and cause a larger outbreak, like we've seen at different points throughout the pandemic.
Excellent. Thank you.
Any follow-up questions on contact tracing from the other reporters? All right, we'll go back to Isabella from the Times Standard.
Thank you. So I'm sure Dr. Hoffman and other members of public health are talking to public health officials from across the state multiple times a day. And I'm curious as to how they respond to our situation here in Humboldt, and, you know, what advice they have given and what they are doing that we aren't.
Yeah, it certainly is. We've garnered attention of the state with the numbers. You know, we've been reached out to by many people in public health and, you know, private sector and the government, you know, offers of support and help. And I think really we're doing everything we can. I think the reason we're seeing the numbers here like they are is a combination of factors, some of which we couldn't control, like the introduction of the UK variant at a time when we still didn't have a large population that was vaccinated, and also a larger population potentially than the rest of the state that was never infected. If you look at our infection numbers throughout the pandemic, we have nearly 1/3 of the infections because we were protected geographically. We, again, people following the rules. And so, because of that, we didn't have hospital surges like other places did, but we also had lower numbers of infections overall. The state is looking very closely, offering resources, offering what they can. But really the tools that we have to get out of this right now are vaccination and participation in contact tracing. I don't think the public health measures by shutting down businesses aren't going to work at this point, because they're really, they were again geared at a different goal in mind, which was really to protect the hospital system. So using those other tools that we have, the contact tracing and the vaccination effort, are the tools we have going forward, and we'll continue to use those. And just to give you a sense of the kind of support we get from the state, we have dozens and dozens of workers from the state, both on the contact tracing side and the vaccine side, who are working remotely, who are full-time with us here, some of them in Humboldt, and have been here for many, many months, some of them. So it's a huge statewide effort, and the state is continuing to grant us those workers, recognizing that we are in a different place than some of the other counties that are seeing their numbers go down.
Thank you.
Any follow-ups on that? Right, Carlos from North Coast News, any additional questions?
Yes, on the subject of the June 15th reorder, is there any possible advice you could offer for businesses that may have difficulties during the initial phases of it, that may try to continue to enforce mask policies as a private business?
Yeah, I think it's definitely something that is going to be seen, to be expected. Going back to the early days of the pandemic, when before there were mask mandates, there were certain businesses that early on decided to ask all their employees and all their customers to mask, and that's certainly their rights as an individual business. And so I think that just like we saw in those days, there will be folks who don't want to follow those recommendations, those requirements, and we certainly don't want to create an environment of hostility. So hopefully people will take heed in that, and if a business says we want to protect our employees and our customers by continuing to mask, people will follow that. We certainly don't want to encourage people to get into any hostile arguments or shouting matches. I think we've all seen that, and it's non-productive. So we try our best to encourage people by offering them a mask, by putting up clear signage of which business is going to require a mask or not, and just supporting our businesses in that process. So hopefully there will be some more guidance from CDPH as we come closer to that, and they do have something more concrete. And in addition to that, there is the Osha Guidance, which was delayed. It was supposed to be voted on May 20th, but given the changes at the CDC that were unexpected, they decided to delay that till June 3rd. So, I think that will also have a pretty big impact on what is actually required from employers around masking, around quarantine, around, being fully vaccinated and what's allowed and what's not. So we're still waiting for that. So there's a lot of questions up in the air, but I think that what we should expect is that there will be some businesses who decide to be more strict and others who decide to go with the bare minimum that they're required to do, just like we've seen all along.
Great, thank you.
Any follow-ups on the June 15th reopening? Support for businesses or anything like that? Right. Any additional questions, Thad?
Not at this time. Thank you.
All right. Isabella, any additional questions?
Nope, you guys covered it.
All right. And Carlos, any final questions?
No, not at this time. Thank you.
Great. Well, I'd like to give our panelists an opportunity to share any closing thoughts just about something you're working on or something that you're looking forward to come, June 15th. Let's start with Sofia.
Oh gosh, well, I don't have any thing to say other than just want to give a lot of credit. We talked during this, we've spoken about our partners in this community, all the folks that are vaccinating, the pharmacies, the healthcare providers, and we couldn't do it without the support in the public health system. So it's going to take all of us to move through this and get folks vaccinated as much as possible. And just really grateful for the partnerships that we're seeing in this community. Thanks, everyone.
Thank you, Sofia. Supervisor Wilson?
Well, thank you. Really, the message of the day is how important vaccination and vaccination rates are to helping us move into really just a more functional community, and not pulling away from the importance of that. I also want to see if we can also start thinking about some of the changes that we've made to adapt and respond to this this epidemic. A year ago, or even I guess a year and a half ago now, is not going to be the same as it is today, and it's not going to be the same as it was in a year and a half from now. It's not going to be the same as a year and a half ago. That's what I'm really trying to say. And there have been responses to this epidemic, and some of which we've seen, in our behaviors and our patterns and our lifestyles. Some of it we've even seen on the landscape in terms of opening up outdoor dining or really reevaluating our public spaces and how we use those spaces, both within our business community as well as in our neighborhoods. And we've seen that across the nation. And I think this is even though we're really concentrating on trying to get through this, we also need to maintain future focus as well. What are some of the positive things that we've seen in these changes that we've had to adapt to? What pilot projects really have we done in terms of access to our, to our public and open spaces, as well as how we do work, what telecommuting means, the sort of hyper localization that we've seen, and even neighborhood connectivities. What are some of the positive things that we've seen come in? And I encourage citizens to really, before we lose those things in our rush to what we perceive as our former normalcy, what is a better normal we might want to seek in the future? I encourage citizens to think about those things and reach out to your decision makers about what changes you may have seen that you might want to consider in terms of a healthier and happier community moving forward too. So that's also it relates to public health and public safety. And so I just want to also keep our eye on the future as well as I don't want to lose focus on what we're doing right now, but if we don't take stock of some of these changes and observe what they are, we may lose some of the positives that have, or some of the opportunities. So and thank you again. I just have to say 441-5000 for anyone who has questions. That's just the easiest place to start. Thanks.
Thanks again, Supervisor Wilson. Dr. Hoffman?
Thanks, everyone, for the opportunity to have this great discussion today. Yeah, I think echoing on Supervisor Wilson and Sofia, just that, you know, the world is not the same place as it was before COVID hit us a year and a half ago. And there are many changes that will never go back to the way it was before. And then that really this public health effort over the course of the pandemic has been a tremendous one from all of the folks here who have been on public health front lines for many decades, many of them, to the partnerships that we've made with others in healthcare, in the nonprofit world, in the business world, government, you know, Board of Supervisors support for our efforts, you know, the pharmacies who've stepped up, the clinics who stepped up vaccinating. I mean, just it goes to show you that this effort is far-reaching and wide, and that we are all public health. And so I just want to thank everyone who's done their part throughout this. You know, it's incredible that we're moving towards that June 15th reopening, and I think it's encouraging in many ways. Despite the numbers we're seeing, it is needed, and we need to get back to work. We need to get back to some of the ways that we had before, and you know, just hopefully you know, get the message out there, get vaccinated, and we'll keep doing our best in public health to protect those who you know, who are still you know, who can still potentially be infected by this disease. So thank you.
Thanks very much to all of our panelists and to our media representatives for joining us this morning. We will provide the recording as soon as possible, and just echoing Supervisor Wilson, don't hesitate to give us a call at 441-5000. Have a great day, everyone.